Welcome to the Reimagine podcast. Each week, give yourself 30 minutes and meet the people working hard to create the future of insurance today.
Hi, this is Paul Tyler. We recently attended the first Medicarian conference in Las Vegas. Jay Weintraub took the top Medicare Supplement conference and broadened it to include innovation across the entire senior healthcare space. We interviewed a number of leaders on the event floor and pulled the recordings into 3 podcasts. Today, in part 3 of 3, we'll explore innovation in improving senior healthcare. With new technology, extra benefits of plans are quickly morphing into digital health management platforms. And those platforms include items like devices, fitness programs, and even food. Can you tell us, who are you and what do you do?
Yep, sure. I'm Ashley Trenier. I'm the founder and CEO of Farmbox RX. Farmbox RX is an engagement and technology company in the healthcare space where we deliver food as medicine to Medicare and Medicaid beneficiaries.
And what got you started into this industry?
Well, way backing up, I'm the farmer's daughter, so my father was a farmer in Southern Illinois. And then backing up 12 years ago, I was a single mom on food stamps with my now 11-year-old daughter, and I lived in a food desert. And being a single mom and living in a food desert on a very limited income, which is what our seniors and Medicaid population face, trying to eat healthy is very, very difficult. And so I launched Farmbox Direct 8 years ago, which was our direct-to-consumer legacy product. And then 2 years ago, when CMS allowed health plans to offer food and produce to be offered as a benefit, we pivoted over and created Farmbox RX, and that's the lion's share of our company now, and we are a healthcare company at the end of the day now.
That's awesome. And do you still source from your farm?
No, my dad was a soybean farmer, okay. So no, we don't source anything from there. But we have 2 distribution hubs, opening our 3rd. We deliver nationally already. We're just getting closer to the member, and we have 5 by the end of the year that'll be opened across the country. So we always try to source, as close to our DC as possible. Obviously, it makes sense on food logistic miles as well as financially makes sense. But, depending on the season, we may have to source from California, Arizona, Texas, to go to, even our Midwest DC.
Now, who are your primary customers? Are they the healthcare providers?
They're the health plans.
Health plans.
So the health plans are our customers, and then they provide this box to their members. So we came to Medicarians because it's really known more so as a broker conference, and brokers are cheerleaders. They really inform the health plan as to what benefits their members want, and they're at the referable moment being in the home with the member. So we have 63 health plans we're going into 2023 that we work with. And so, brokers are really, really important to us, that they know about our benefit and being able to offer that benefit to their members if their members are in need of it.
Now, what are your goals for the next year as a startup?
So, it's funny. We are kind of a little bit of a startup in the health. We've been in business for 8 years, but the healthcare side is a bit of a startup. The good news is we have revenue, we have contracts, and I'm not back to the startup phase of when I had, we literally pioneered how to ship produce to your door via FedEx and UPS. So, the next year is really more so building out our team bigger. We have about 32 employees now. We outsource all of our operations. So, packing boxes is not what we do. We're the business of Farmbox, really. Building out sales and marketing is a big piece for us. It's been painful. We're in the middle of a fundraise. We're actually getting ready to close. We just had a term sheet come in, which it's an exhausting process. So I think we may have 2 more term sheets coming in. So raising money is the worst thing ever.
No, but congratulations on being able to do this.
Thank you.
Yeah, well, I guess sort of last question is, why are you bullish on the Medicare space? Because it's, if you're growing a business, you got to be very careful where you put your resources and your time. What makes you feel good about this space?
So we were the first ones in on the market in 2020. We really came in and we piloted this program, actually with Vibra Healthcare in Pennsylvania. And so we had first mover advantage. So we grew from 1 health plan to 30 health plans to now 63 health plans. We have a top 3 national next year, and that's really going to make us a table stakes benefit. I can't say who the top 3 national is yet until October. But it's going to make us a table stakes benefit similar to dental and vision. And so we knew that this product was so successful within member satisfaction, also moving, quality outcomes like HEDIS gap closure. We knew that we were just going to continue to dominate the market, and so we put all of our money in on healthcare. And turns out that was the right move for us. Direct to consumer is really, really a tough space right now after iOS 14, iOS 15, for direct to consumer companies to have a like a good LTV to CAC. So this was a way better option for us because we have, our customer is the health plan, and then you have thousands of members from that health plan to hundreds of thousands.
And how do you create awareness to make people realize that this is available?
Brokers is a big part. It's why we're here too. We really partner with the health plan on marketing. Health plans really actually want to market this benefit. CMS has really said, the Center for Medicare and Medicaid has said, we're not doing anything unless we look through the lens of health equity. And so, health equity is everything when it comes to food insecurity, right? So the health plan has really been a big cheerleader for us too. They want their members to have access to healthy food because if they don't, it can lead to hospital admissions, chronic conditions. So that's really our biggest marketing tool, is just partnering with the health plan and being, a good partner to that health plan.
That's great. Well, thank you for stopping by. Where should people go to find more information about your company?
LinkedIn, FarmBoxRx, and our website, FarmBoxRx.com.
Excellent. All right. Well, thanks so much. Good luck on your fundraise.
Thank you so much.
Great.
Thank you for the time.
Thank you.
Absolutely.
Thanks. Who are you, and what do you do?
I'm a man of mysteries. I will never tell anyone what I actually do.
Ha ha ha.
Yeah.
Hey, well, quite a conference.
I know, it's amazing, and it's still too early.
What is your assignment for Jay here today?
Well, my role here is to MC the innovation and product showcase stage. And basically it will be to introduce all the amazing startups that, well, it's not only startups actually, it's not limited to startups, but also other products by more mature companies to go on a stage, introduce their product, their innovation, give their spiel, and come off. And we will need to introduce them in the best possible way, hopefully.
Yeah, now we just heard Jay really do kind of the official handoff between Jesse, who had taken the conference, built this up as probably the only Medicare conference in the country you were at. And Jay's got a great vision to make this thing bigger, make it more expansive, make it about senior health. Yeah, so he had, Jay brought up, the guy who actually invented Siri. Heard his story of being acquired by Steve Jobs, and his journey to now sort of pivot into the healthcare arena with an app on a phone that will actually take blood pressure with your light on your mobile phone. Is that amazing? Think about this. You go to the doctor's office.
How is that going to work?
Well,
because
apparently the flashlight actually can do such rapid pulses of light. The cameras can actually read what's happening in your capillaries and detect not only your heart rate but your blood pressure. Now think about it. You go to the doctor. You
need to put on the sleeve.
And when was this technology invented? Probably 100
at least
years ago, right? Well, probably. I think it's an Israeli invented this. No. No.
I don't think so.
I guess no.
We invented one or two things, not ever.
Yeah.
Wow.
Yeah. So, really, he's sort of taking. He's going to open daily blood pressure measurements to millions of people who never would have had blood pressure readings up to this point.
Yeah, because today, what do you need to do? You need to go to a clinic, or you need to buy one of those one of the different brands that are out there that will cost you between $60 to $100 if you want something that is a little bit more accurate and with the Bluetooth, without the Bluetooth sync to your different devices, and everything is connected after all. And it's a limitation because even when you buy, and I actually bought one because I wanted to check, hey, what's going on? I'm in my 40s, I should check what's going on with my blood pressure. And the answer is, I have the device. Do I use it? No, because you need to take it out, you need to put it, and you need to relax and to make sure that it's to get the right results. And then you start to hack the device to make sure that you get the right result. But that's a different story.
No, listen, I during this whole pandemic, I used the oximeters. I found out, by the way, my Apple Watch did just as good as the medical grade oximeters that we had in our shelves. So I think the phone has an opportunity to revolutionize healthcare, not only for the general population, but seniors as well. So
it's accessibility.
Yes.
It's all about making new technology accessible to people and that they can use, right? We have the seniors getting, more technically enabled, and it's also easier to use. It's not like at the beginning when they introduced cellular phones, my grandparents, they had a flip phone. Actually, it was a Nokia something. And, it always was in the car just for emergency. So if something happens, they had to find it in the glove compartment, take it out, power it on, and then call, 911 or 100 or whatever that may be in the different country. Yeah, it's nowadays you have...
no, it's incredible. So you met a few people.
Mm-hmm.
You've walked around in the booths. What's your biggest hope for the conference, for you personally?
So for me personally, as you mentioned earlier, something that Jay said, it's about health. I will add the wealth, and then of course quality of life. And we started yesterday meeting more people in the reception, and now we started to walk here at the booths. And for me, it's all about creating the connections. And to make a connection, a relevant connection, need to know the people, need to know the companies, who is looking for what are you doing, what do you think? It's not just who do you want to meet in this conference, but later on, during the year, what's the biggest challenge? Oh, by the way, there is like a cluster of agents here. There is a cluster of incumbents, also all this technology, lead gen, all the different people, all the cluster of services that we need to help them meet each other, and part of them also already have the relationship, but then it's a question of where are we missing relationships, who can we introduce, so this will be fruitful. It may not happen today. Next year, we're going to introduce more companies into this ecosystem. Hey, it's all about the win-win-win-win-win situation, right? This is how you develop an ecosystem.
Excellent. I'm looking forward to a lot of good conversations you and I will have with some of the people who really changed the industry this year.
And we're going to bring them in, and we're going to ask them, what do you want to see in a year from now?
Excellent.
2 years.
All right.
Fantastic.
More to come. Thank you. Who are you and what do you do?
My name is Mike Ramsey. I work for Carrington International, and I'm the Director of Sales over here.
Excellent. And what does Carrington do?
Carrington actually does a lot of things. We own one of the largest dental networks in the country. We also own a couple of virtual health networks that include physician access, mental wellness, definitely focusing on the student mental wellness, as well as teledentistry, and now virtual pet.
Virtual pet?
Virtual pet care, yes, sir.
Oh, wow. So we're talking to a lot of companies who are doing some really novel things using technology. Tell me, like, what happened with your whole telehealth program during COVID?
Yeah, I mean, telehealth has been around for so long, and it's all of a sudden everybody now knows what it is, right? Before, you talk about telehealth and nobody really understood it. And then once the pandemic hit, everybody needed it. Everybody needed to go to the doctor, have access to something. So being able to sit at home because you cut your finger and couldn't go to the urgent care anymore because it was shut down provided you a way to at least have a conversation with somebody. Yeah.
So what's the future? We've seen some of these companies go sky high during the pandemic, Zoom, Peloton, and then the expectations starts to slow down a little bit. What's the future of telehealth?
The sky's the limit. I mean, we launched our teledentistry product in the middle of the pandemic, which was great. Just a great way to say, hey, I chipped my tooth, or I'm having a toothache, or maybe somebody just wants a second opinion. They need a filling, and hey, do I have time to get the filling done, or is it going to really result in a root canal? So you can definitely save some people, but money from that aspect. But then the virtual pet program, it's like, hey, everybody, their animals are their kids, right? These days, they're just another part of the family. So my dog ate some chocolate or ate a bird or just something, he's limping or he's, doing something like that. It's just, virtual health is just going to continue to expand.
Well, I think the dog population in my neighborhood doubled or tripled over the last year, so I think you've got a lot of future customers.
Yeah, I think the children population increased too.
I think you're right. So if people want to find out more about Carrington, get in touch with you, where do they go?
Yeah, you can go to www.carrington.com. You can also reach out to me directly at MikeR@Carrington.com, and that's spelled CAREINGTON.
Excellent. Thanks.
Hey, sounds good. Thank you, Paul.
Who are you and what do you do?
So I'm Guy Benjamin. I'm the co-CEO of a company called Healthy. We basically help employees navigate their health benefits using an AI tool called Zoe. Zoe becomes their personal health assistant. She knows how to analyze any health and wellness benefits plan. So it doesn't matter if you use Blue Cross Blue Shield, United, Cigna. She takes all that information from that health plan, convert it to a structured database, layers on top of that all your other health and wellness benefits, and kind of give you what we call a digital door to all your health and wellness benefits. So you no longer have to call anybody. You can just ask Zoe on your phone or on your laptop. She's always available, never on PTO, and she'll give you answers immediately about stuff like, am I covered for a speech therapist, or can I go see a specialist? How much it will cost? Booking an appointment. She also proactively reaches out to you to let you know about specific benefits that you should be aware of, like preventive care or mental health benefits. So that's what we do.
Yeah, excellent. And full disclosure, I actually have walked through that door. It was great to have you come and visit our visit Hartford, Connecticut. I think that was November.
Yeah, I think it was November.
Yeah. And we have startups and come through and do pitch sessions, but I literally had a couple of our employees see your presentation, say, we got to get this here at our company.
Yeah.
And sure enough, we ended up with a pilot. I think we've had really good success. Yeah. I think this will be I have a feeling you'll be a long-term benefit for our employees. So what excites you most about the Medicare space?
Yeah, it's a good question. I think for now we're really focused on the employer benefit side, right? But when you think about Medicare, there's so much opportunity, right? There's so many opportunities there to help people just understand what they're covered for, how to pick the best plan for them, how to answer any questions that they have ongoing, right? Like today they have to call these call centers or they don't even know about it. I think Zoe can really merge into that space as well and help people be healthy, not just when they're as an employee, but also when they go and use other plans like Medicare or Medicaid.
Yeah, well, I also think that once you start talking to people in the HR community, there's an easy transition into Medicare Supplement. I had a moderated panel discussion yesterday, and with the Medicare Whisperer, Mike Alexander is a terrific guy. And he said, get to know the HR managers, and you'll never go short of leads in Medicare. Right. So I think you're right. There's a natural transition. And
I would also say that I think we speak a lot about Medicaid and how to use it better, but we also should speak about how do we get people to retire, for example, healthier. Right, and that's exactly what we try to do. I think Zoe can help people get to a retirement age at a much healthier status than if they hadn't one, right? Because she reminds them to go get this yearly physical, those preventive care benefits. Late detection is a huge issue in the U.S., and Zoe helps with that as well. So it's not just helping you navigate your Medicaid or when you retire. It's also getting you to a better shape when you retire.
Yeah, I would think there'd be a few opportunities. One is understanding the plans going in. But also, how do you activate those benefits? I've heard a lot of discussion about retention. Do you think your tool could provide more help on the acquisition or the retention side of the equation?
Yes, definitely. I think so, because when you think about retention, when you think about activating all those benefits, that's where Zoe exactly comes in, right? She's not only she's not only there in the background, she proactively reaches out to you and let you know about different benefits you should be aware of in specific times based on your profile. So that's exactly that.
Yeah, and any big ahas or surprises at the conference the last couple of days?
First of all, I think how big the conference is and how many people actually here. I think there's more than 1,000 people here, which is great. But I think it's also, for me, the biggest aha was I came in just trying to keep an open mind, but it really gave me the sense that there is a huge opportunity and we should look much deeper into it.
Yeah, well, that's great. Thanks for coming by. How should people find out more about your company or contact you? Yeah,
well, feel free to email me. I'm at guy@healthy, which is HEALTHY thee.co, or find us on our LinkedIn page.
Okay. Well, excellent. Yeah. Hey, listen, thanks for the work you're doing for our company, and thanks for coming by here today.
Yeah, thanks for having me, and thanks for the partnerships.
Yeah, thank you. Hi, who are you, and what do you do?
My name is Christopher Lichty, and I work with Atalis Health. We are a company that provides remote patient monitoring, also called RPM, solutions. We are strong in the supply chain area, where we source devices from China and other things like that, but we've built a platform with strong patient engagement, and the idea is that we work with a healthcare company, a hospital chain, could be insurance companies, but to send kits to their patients to help them manage the one or more chronic conditions that people in Medicare age range have. And the flexibility is really one of the main benefits there, because we can swap out different devices, blood pressure cuff or temperature or a weight scale or glucose monitoring. We're even looking into things like pressure sensitive fabrics and how that could be used. So anyway, any of those diagnostic things, we kind of built a platform that can swap those out depending on the company's needs or the patient's needs, and then we bundle all that together into a nice platform, and then we take that whole thing and plug it into a healthcare system for providers to make decisions on.
So is it sort of like a Lego kit for senior health, or for patient health in general?
Yeah, yes. And so for people who have chronic conditions, we have the Legos. We which Legos do you need? Which Lego package? Right?
Good analogy, Paul.
That's great. Exactly. So do you want the Volkswagen Bug or do you want the flowers?
Hey, Christopher, how long have you been doing this, and how long has this tool or service been in effect?
Well, our company is 1.5 years old from funding to today, and we have our first implementations in place, and so we have revenue. So I've been involved in this only 2 months, actually. I come from a medical laboratory situation and just joined this group. It's actually a group of startups, and there are 7 companies, and I'm head of marketing for all 7, but this is the main one I'm working on right now, is helping to get this up and going. And I really like it a lot.
Interesting. Well, what are your goals here at the conference?
My goals are, number 1, to learn the space, right? Learn where we fit in the ecosystem. Number 2 is to speak with potential customers and learn who those customers might be, do customer discovery. But we've already gotten some really good, the very first conversation I had walking in the door, ran into somebody, talked to them, and they're like, boom, I need you to talk to our CEO. So I was like, that's good. I like that.
So has your model evolved since you first started it, from working with healthcare providers, hospitals, to insurance manufacturers? Has it taken any different direction than you thought initially?
Yeah, actually, I had a conversation today with an insurance provider that I learned a new thing, which is the billing has to be different, right? So there's a challenge there because Medicare provides CPT codes for a provider to bill for collection of vitals information, but insurance companies don't have that. And so, but there's a great benefit to insurance companies to reduce hospital days and emergency room visits and all of that, to predict those in advance and prevent them, right? And so we just kind of have to work that out. It's a new thing for me to kind of start sorting out how this connects with the insurance providers.
Interesting. And what fuels your passion for this market?
Well, it's customer experience, patient experience, right? I have a background in design and design thinking and innovation process, and that is my passion. Most of my years were in the financial industry, and there it was very similar, trying to help people manage their own money better. Even back into the late 90s, we were talking about the pig and the python of the generational boom, and here we are today. That's it, right? Not very many people in the younger generation to take care of people. We need efficiencies. We need We need, there's the loneliness that Erica Schwartz was talking about this morning. There are all the things I live to make people's lives better, and that's what gets me up every morning.
Hey, terrific. Hey, thanks. So if people want to learn more, connect with you, or they want to learn more about your company, where do they go?
Go to Atalis Health. Atalis is an Icelandic word for fearless, meaning, if you have good information, you have less fear. And OTTALAUS health.com. OTTALAUS health.com.
Excellent. All right, we'll put it in the notes. Thanks so much.
Thanks so much.
Yeah, look forward to seeing you later in the day.
It's a pleasure.
Thank you.
Thanks.
Thanks for listening. If you enjoyed the show, please rate and recommend us on iTunes, Stitcher, Overcast, or wherever you get your podcasts. You can also get more great information about this company and other great startups at imagine.nfg.com.